Well, I've been a dietitian for 15 years, and in that 15 years it's been really frustrating to watch Australian obesity statistics increase, knowing that there's a profession there, dietitians, who are specifically trained to partner with GPs to get people to lose weight. So I pose the question, can dietitians turn around this obesity epidemic? And when I first started out, a report came out, an international economic analysis, that actually showed that this GP-dietitian relationship is the most cost-effective long-term strategy to stop obesity. So I knew I was onto something and was definitely worth pursuing. So I designed a study called the Measuring Dietetic Practice for Obesity study. And that study was about using this system and capturing what that system does to then report how well we're doing for obesity with this system here in Australia. It's this system, this same program that we use here in Australia that dietitians are trained towards, and also the same system that was in that economic report. So phase one of measuring dietetic practice was to look at what dietitians would need to measure, how they can measure it, and what that looks like in a report. And then to go out into the field and have a look how far or how close we were to practice. And that's where we saw the first major problem. And that problem is dietitians are collecting information, but they had no systematic or routine way of capturing that information, and so they weren't able to report what they were doing. So this study isn't about finding the one perfect treatment for obesity. It's asking, whatever it is the dietitian does with this patient at this time, in that clinic, in that moment, we want to capture, record, and report it back in real time. So in the field, dietitians currently didn't have any system, and they had limited capacity to develop a system to capture this data. So phase two of MDP was to build a simple electronic system to capture this relationship, capture this rich data exchange to get better patient outcomes. Phase three was to design a randomised control trial to test the hypothesis that dietitians who use this system and have that data reported back get better weight loss for their patients compared with dietitians who don't have that data. And that's the first time internationally that an electronic system is going to be tested for whether it can actually improve patient outcomes. Now, Julia Gillard is actually following MDP on Twitter, and I'm sure the reason is because what we're proposing here is a cheap way to improve health outcomes. And the other thing is about doing better with what we've currently got. So can dietitians turn around this obesity epidemic? Well, yes, they can. And the MDP study is going to generate the data to prove it.